committee came into being. And just 3 years later, we came up with the FICCI Health Services Award or Healthcare Excellence Awards. These awards have come to niche for themselves and today are reckoned to be the Oscars of health services. It has taken a long journey of 12 years for us to keep modifying the awards from time to time in keeping up with the traditions and with the practices. But as they say, and it has been said in the Yiddish proverb, probably the best, man plans and God laughs. This year, in order to have the best possible recognition for the fact that in Dr. Sangeeta Reddy, we have, as the president of FICCI, a member from the health services, we wanted to really do a grand job of this conference. In a way, we have, because that we are holding the first time that the FICCI Healthcare Awards are being held virtually, and which is the first time that instead of being the 2-day ceremony, it has become a 3 days. But let's stick to the FICCI Healthcare Awards. And in addition to welcoming all of you, I must take recognition of the presence of the chairman of the jury of this year's award and an old friend of FICCI, an IAS officer of great repute, a man who served as the secretary of in the Ministry of Health and Family Welfare, and who's recently retired from the Ministry of Environment, Forest and Climate Change, Mr. C.K. Mishra. Mr. C.K. Mishra is going to do the double job. Not only are these his awards, because he was the chairman of the jury, but he's also going to be our guest of honor. He will be joined later by one of his compatriots, another seasoned administrative officer, Mr. Rajiv Gauba, who's currently the cabinet secretary. This is also the right moment for me to welcome our president, Dr. Sangeeta Reddy. It's a great honor, as I said, to have, as the FICCI president, a member from the congregation, so to say. I'd also like to record the presence of Mr. Dilip Chenoy, the Secretary General of FICCI, who's been a great help, particularly during these COVID pandemic times when we have struggled with now. Last but not least, the man who has led us, the FICCI Health Services Committee, during these very difficult times, Alok Roy. I'd also like to recognize the representatives and the Health Services Committee members. Ladies and gentlemen, let's begin with the FICCI Health Services Awards. These are the 12th Healthcare Services Awards for in recognition of the services that are provided by organizations and by individuals. Just to take you quickly through some of the steps that we take and which makes these awards so distinctive and the reason why these awards are so coveted. We are partnered by E&Y, and Ernst & Young has done a lot of awards, and they themselves tell us that this is one of their greatest offerings. So, inspire change together is the theme under which we work. There is a pre-jury, and this flow will tell you how rigorous the process is, that we discuss the categories, then we create a portal, we call for the entries, the core group members meet and decide, like this year, and this is particularly, this process overview is for this year. This year we decided that COVID-19 is going to be the theme of our awards, as also there is a screening jury, or what we call the interim jury, that goes through all the, and there is a second sitting of the jury and the final jury. In the olden times, we have also had the additional point by which it was necessary for the hospital that was selected or was nominated to actually have a visit by our partners, Astron, led by Dr. Yash Bhatia and his team, who used to go and visit and physically verify what you had given in your application. This year, that has not been possible, but Ernst & Young has done a yeoman's job in trying to fill up the back part of it. So from the process itself, you will realize how difficult and how time consuming this has been. And now my grateful thanks are due to all those who contributed to this. The objectives of these awards are very simple. They recognize excellence. They facilitate all those individual contributors and organizational contributors who give our healthcare industry a good name. This year, the award categories includes a special award for the COVID as well. So let's move ahead and go to the interim jury that was there, which first screened these awards. And as you can see, this is the second reason why these awards have stood the test of time, and that is the excellence of the jury members. So one is the rigorousness of the process. The second is the quality of the jury. And the third, as you will see over a period of time, those who have been selected are virtually the who's who in the healthcare world. And it is not that this is an industry body, therefore it recognizes the efforts only of those who are in private sector, but it is an across the board thing. So going still further ahead, if we take the next slide, this is the final jury. As I mentioned, Mr. C.K. Mishra is the jury chairman this year, with Dr. Alok Roy as the jury co-chair. And you can see from the list of the final jury members that excellent jury, which has done a wonderful job. Particular thanks to Sri C.K. Mishra ji for being with us right throughout whenever the meetings were held. And there were very heated discussions at times because it is not an easy process. Now, before we go ahead to the next step and start the Healthcare Excellence Awards, may I request the President of FICCI, Dr. Sangeeta Reddy, to welcome you all. Dr. Sangeeta Reddy, please.
Ladies and gentlemen, good morning and namaste. It is indeed such a pleasure and a privilege to be speaking to all of you today. I don't know, I think a welcome address is more appropriate from doyens like Dr. Narottam Puri, who have put this program together, from Dr. Alok, who is our chair of healthcare, Dr. Mahajan, who's chaired the dynamic coordination of this conference, Shobha and the secretariat team. So I'm actually going to begin by congratulating and truly appreciating all of you. However, whether it's a form of welcome, appreciation, namaste, whichever, I do want to acknowledge and thank the presence of Dr. C.K. Mishra, not just for being here today, but for the tremendous role that he's played in healthcare. Your period as health secretary, the continuous advice that you have given the sector, the industry, and me personally, and FICCI, will always be remembered and appreciated. Dr. Mishra, thank you so much for everything. I also want to welcome Dr. Rajiv Gauba, our Cabinet Secretary, Government of India, who will be joining us shortly, and we're honored to have his presence. I believe it's also my pleasure and privilege to welcome every single member of the audience who is here, and I think our registrations have crossed 2,700. From what I heard yesterday, I don't know what the number is this morning, but truly welcome to each one of you. I think that there is no time in history ever that healthcare has been so center stage. There is no time when the community and society has called upon us to serve, to care, but also to be brave, to innovate, to understand the challenge that's ahead of us. And to do this, we have had to collectively ideate, collectively build new solutions, and also find ways to stand up there and serve in the face of all kinds of adversity. And I believe that this adversity is something that we never, ever expected. So, whether this adversity has come upon us because of the crisis or the fact that our initial system itself was strong enough, whether it was a need for greater primary healthcare, and I see and warmly welcome Dr. Srinath Reddy in our midst, who spent so much of his lifetime speaking about preventive healthcare, or the fact that we were not adequately prepared for non-communicable disease. And Dr. Pratap Reddy, my father, has been waving that flag for many years now. I think that the combination of the fact that our infrastructure and our systems were not adequately prepared, the fact that we had so much comorbidity amongst our population, as well as malnutrition, and then the impact of COVID, this combination has made the scenario tougher than it could have been. However, we still, and I say this very proudly, I will continue to feel that India has handled the COVID crisis with tremendous innovation, bravery, alacrity, and has come together in a way that we can all actually be very proud of. And testimony to this fact is truly that we have managed to keep the mortality rate at the current numbers, which compare favorably with any country. The fact that we've been able to ramp up our testing to over 12 lakh tests per day, the fact that despite the fact that health is a state subject and every state had a different protocol, everyone has managed to come together to innovate, to care. And I believe that private sector has played its role, albeit the initial, worry, lack of knowledge, hesitation. Private sector has played its role. So I do want to take this opportunity to congratulate every single worker, every single doctor, nurse, but all the ancillary staff, the pharmacy people who kept them, their doors open, the cleaning staff who braved equal risk, every single one of you. You are the unsung heroes. So today, this ceremony is about celebrating the heroes. And I think it's been a decade of doing that. And I congratulate this awards. It has become one of the most coveted awards. The theme of Inspire Change Together is truly powerful. The concepts of innovation, sustainability, impact, and scalability are very critical parameters that you have chosen for the award selection. But I want to say that I'm also very appreciative of the fact that in response to everything that's happened and all the capabilities which have been built up, FICCI Heal is now larger, more global, and a genuine confluence of the best minds in healthcare. So I wish all of you the very, very best for the conference. I congratulate you for what you've put together. And most significantly, I welcome and congratulate every single nominee for these awards categories, because I think this recognition is a recognition of your years of commitment to the space of healthcare. And I'm especially happy that we are celebrating you. So in the same breath, we celebrate every hero of healthcare, of every category, and also celebrate today's winners. Thank you all. Namaste, and look forward to a tremendous conference. All the very best.
Thank you very much, Dr. Sangeeta Reddy. Those are inspiring words. May I now request our chairman of the jury and our guest of honor, Mr. C.K. Mishra, to give his words of wisdom. Mr. C.K. Mishra, as I mentioned earlier, is an old friend of FICCI. He's been to FICCI many a times, and we are indeed very grateful that he accepted to become the chairman of the jury. Now, if you look at the past history of some of the jury chairs, you will find that FICCI Healthcare Awards have been blessed by the presence of some real luminaries, from Justice Lahoti to Mr. C.K. Mishra, who've graced us over the last 11 years, and this is the 12th award that we are now giving. Mr. Mishra is a seasoned administrator, an IAS officer who served for a long time in the regions in Bihar. And then we started interacting with him when he joined the Ministry of Health. He moved from the Ministry of Health as the Secretary of Health to Ministry of Environment and Climate Change and Forests. And recently he has retired, but the government thought it fit to recognize his services to healthcare by appointing him as head of one of the most important panels that the Prime Minister appointed to look at the services for COVID through the hospitals and allied units. Mr. Mishra, we welcome you once again to the awards that you helped select, and today you will be giving some of those very awards you have selected in a few moments. But before you do that, maybe they come for some words of wisdom. Mr. C.K. Mishra, please.
Very coherent. And thank you also, FICCI, for reposing your faith in me to head the jury. These are very challenging times. And in these challenging times, putting an award ceremony of this kind together, I think FICCI deserves all the congratulations and a huge amount of thanks for having put it together. And I must also congratulate all the winners. Let me tell you, it's not been an easy job going through the nominations and trying to get a final winner. Each one of them has excelled in some field or the other. But the jury's job is always tough. We've gone through that. We've taken tough decisions collectively. And today we've shortlisted a few people who will be announcing. But that really, the amount of nominations that we had really go to show the kind of good work that the industry is doing in this country. You see, in these challenging times, when I speak to you, I'm far from being cynical, but there are two observations that I would like to make. In this country, continuously, we've been extreme misers about two things. One is recognizing excellence. We hesitate to say that the other person has done very well. And this is a tendency we need to really imbibe. And if I look at FICCI Healthcare Awards, this is one occasion where we really can say that we've gone out of way to recognize good work. The second thing is, again, as a society, as a country, we've completely forgotten to celebrate success. It is the failures and the shortcomings which are always on our mind. I think as a country, we need to rise above that and start celebrating success. Every celebration of success will mean that it will rub off on others and there'll be excellent performance from others as well. It's not blowing your own trumpet, but it's putting things up front so that people can imbibe that and really, really move ahead. The COVID period has taught us a lot of things, and in a function which is being held in these times, you cannot just ignore COVID. But look at the kind of work we've done. You may have your comments on it, you may agree, disagree, but I very strongly feel that as a country, we've done well. And at a time when the best of health systems in the world have been challenged, we've, to a great extent, withstood that challenge, knowing fully well that we have a health system which is not the best in the world, not as resilient as many other countries, but still, with our meager resources, we've been able to put up a fight. And that is because everybody joined hands together. Otherwise, both public, private, individuals, everybody put in their bit. Otherwise, we've not had this. Look at the other achievements of the country. Look at, for example, your IMR, your MMR, your immunization levels, the TB programs, other national. As a country in healthcare, we've moved ahead. The speed can be questioned, the destiny can be questioned, but the fact that we are taking the correct path cannot be denied. So it's time to celebrate success. It's time to recognize good work and feel good and move ahead. Of course, keeping our shortcomings in our mind. Friends, I always feel that healthcare is about partnerships. If there is one thing in India that is going to drive healthcare to excellence, it is partnership. It is the jointness of the private and the public sector, and it is, as COVID has shown us very well, pooling of resources of the two sides to really take this country ahead. Unfortunately, we've not been able to create systemic platforms where this jointness and the partnership can come up. Mr. Gauba is not here, but I'll surely speak to him later on this, that this is something that government must do. It's government's responsibility to create that platform. Some efforts have been made. But what is at the core of my heart, and I'm so happy to speak when Dr. Srinath Reddy is here, is that we ultimately, both private and public, must look clearly and closely at public health. We should not be looking at a society where we are too eager to treat a sick man, but not that eager to push preventive promotive health. So at the center of whatever we do, we must have public health. And it is in the context of public health that I would just quickly like to share a couple of points, because I'm talking to the industry and one doesn't get this opportunity very often. One of my regrets in public health is that the participation of the private sector and the partnership that I was talking about is lacking. Public health cannot succeed unless all resources are pulled together. And, imagine what kind of a success we can get if both the private sector and the public sector are one on national programs, for example. And there are clear examples of this partnership succeeding, and I would like to specifically mention that one of the fields where this partnership has indeed been very successful is the National TB program, for example. So private sector participation is something that really adds value to the entire spectrum of public health, which should be at the core of our belief. Let me, on behalf of all of you, welcome Mr. Rajiv Gauba, Cabinet Secretary. I see him on the screen. So to continue, the second regret that I would present to you is the lack of reach. And COVID has shown that the private sector participation was brilliant as far as the larger cities were concerned. But in tier 2, tier 3 cities, we were not that forthcoming. We need to create that system where this partnership moves to these places, to the rural areas, in fact. And that brings me to another point. One of the critical learnings of COVID is that our urban health infrastructure in the public sector has lagged behind. As government, as a society, as a country, we need to take a very serious look at it. What do we do with our urban health infrastructure? The urban health mission, to be very honest to you, did not take off. We need to. That means that system will not work. We need to put some other system in place. So as an industry body and the government must come together to create that health infrastructure in the urban areas, which we found today was lacking. And I think there is absolutely no reason why we should have more and more participation of the private sector in our rural areas, for the simple reason that you look at the kind of increasing footfalls in our public health systems. And look at the kind of expertise and resource that you have. After all, the private sector has proven to the world that India is the hub of the best and cost effective treatment in the world. We need to extend it within our country, and you need to join hands with the government to do this. So, friends, at the end, let me once again congratulate all the winners. They have done exceedingly well. Thank FICCI for what they have done, and all my colleagues in the jury. As I said initially, it was not an easy job selecting the best, but we have come a long way and selected the best. I do hope that in years to come, we'll just get better and better. Thank you very much.
Thank you very much, Mishra ji. Thank you so much. Yes, you have given certain ideas which the FICCI Health Services Committee will continue to debate, and we totally agree with the concept that in India we must have health services, not public and private, like we have proven when we have worked together for the COVID pandemics. All hands were on deck, all shoulders together. And it's the combination of the two that has resulted in low fatalities that Sangeeta was referring to earlier. It's a great pleasure to welcome Mr. Rajiv Gauba, who's joined us today, the chief guest of the FICCI Healthcare Excellence Awards today. Thank you, sir. Thank you very much. An IS officer of great distinction, a former Home Secretary, who has also served as the Chief Secretary of Jharkhand government and who is believed to be the architect of the labor reform in Jharkhand. Now here as the Cabinet Secretary of India. He's an IS officer of the 1982 batch, and we are indeed extremely grateful for having you with us and to give away the awards, particularly to the individual category awards, which we would request you to hand over yourself. So let's begin, ladies and gentlemen, with the award ceremony per se. We start first with the award presentations in the general categories. And please understand that these awards being virtual, you will see your award certificate on the screen only, but these will be dispatched to you over a period of time. We received over 100 entries, and the first category that I'm calling for is the medical device and medical technology category. The award will be handed over by Mr. C.K. Mishra. So let's have the nominations.
FICCI is here with its 12th edition of Annual Health Awards. Commemorate these esteemed individuals who have made a significant mark in the healthcare industry with their outstanding and innovative work. Nominations in the category of Innovative Medical Device or Technology are Translumina Therapeutics LLP and Wipro GE Healthcare Private Limited.
So these were the two shortlisted ones. May I request Mr. C.K. Mishra to announce the winner?
And the winner in this category is Translumina Therapeutics Limited.
Congratulations, Translumina Therapeutics.
From me, Gurmeet Singh Chugh, and my partner besides me, Punita Sharma, we sincerely thank FICCI and the jury. It's a very humbling moment. Something we started 10 years back in a market of drug-eluting stents where most of the Indian manufacturers were either copying, or Asia and especially India was not looked upon something which could create a high-end medical technology from a time today when with this particular device, we have created the longest evidence of a drug-eluting stent technology in the world, which is even better than what US multinationals have created. And not only that, we also publish the data in Journal of American College of Cardiology, which is considered to be one of the best journal of cardiology. Sincere thanks to Mr. C.K. Mishra. It's a double unique his stint in as an additional secretary in health and later as a secretary in health. He created some conducive policies of regulations and promotion of medical devices and domestic manufacturing. And it could not have been better to get this award from him. So thanks, FICCI, and thanks, Mr. Mishra.
Thank you, Gurmeet.
Now let's move.
Translumina Therapeutics LLP.
Okay, so congratulations, Translumina. Now we move to the second category, which is excellence in scaling up of manufacturing demand for COVID. And let's look at the nominations.
Thank you.
Nomination in the category of excellence in scaling up of manufacturing for COVID demand is Vanguard Diagnostics Private Limited.
So may I request Dr. Sangeeta Reddy, President FICCI, to please recognize them and give them this award. Is somebody from Vanguard Diagnostic here?
Yes, good morning, everybody, and good morning, Dr. Puri. And thank you very much for this honor. I must say that it feels a little surreal and gratifying at the same time to hear ourselves being announced as winners today. Looking back while working on the VDX viral transport kit, we faced a number of challenges because of the lockdown, which were not limited to just technical upscaling and logistics. But we knew that we'd have to keep our learning curve short and efficient. So the entire team rallied around this initiative, and we were able to develop a high quality formulation, which we upscaled 400-fold in a record time of 6 weeks. I'd like to thank my colleagues, Rahul Thakur, Dr. Tiwari, Anil Virmani, Raman Maurya, and the entire team at Vanguard Diagnostics for making this seemingly insurmountable task achievable. We'd like to dedicate this award to the Indian diagnostics industry because we see it as a small victory for indigenization, import substitution, and self-reliance. And to FICCI and the award jury and the colleagues from industry, thank you very much indeed.
Congratulations,
Vanguard Diagnostics Private Limited.
So this was for their development of the kit, award given by Dr. Sangeeta Reddy. May I ask Dr. Sangeeta Reddy to give away the next award too, Excellence in Telemedicine and Digital Health. Let's look at the nominations.
Nominations in the category of Excellence in Telemedicine or Digital Health are Arvind Eye Hospital, Pondicherry, and Aster DM Healthcare.
Dr. Sangeeta Reddy, could you please announce the winner? You're on mute. Could you unmute yourself and announce the winner?
We just played. Kapil, if you just play the thing.
Aster DM Healthcare.
So I had a bit of an audio problem. Congratulations, Aster. Very happy to be able to welcome you into this and to congratulate you on winning this award.
The jury also decided that for providing eye care through the vision care centers in ophthalmology, even during pandemics, they would like to recognize Arvind Eye Hospital, Puducherry as well. So congratulations.
And I think that's a very appropriate thing to do. We know over the years how much they have done. So I think we have a special recognition to Arvind Eye Care System, which is most appropriate.
Thank you very much, Dr. Sangeeta Reddy. So the awards goes to Aster DM Healthcare with a special mention to Arvind Eye Institute. Now, moving on to excellence in capacity building. May I request Mr. C.K. Mishra to do the honors this time? Let's take a look at the nominations in excellence in capacity building.
Nomination category of excellence in capacity building are Apollo MedSkills Limited, Max Super Speciality Hospital Saket, and Wipro GE Healthcare Private Limited.
Request Mr. Mishra to announce the winner.
And this award this year goes to Apollo MedSkills Limited. Congratulations.
Apollo MedSkills Limited.
Anybody from Apollo MedSkills available here to so-called collect the award? Anybody from Apollo MedSkills? Okay. Let's move to the next award category, that is excellence in social initiative. Let's take a look at the nominations.
Nomination category of excellence in social initiative are Bhaktivedanta Hospital and Research Institute, a project of Sri Chaitanya Seva Trust, Thane. Azad Institute of Dental Sciences, Reliance Foundation, Ghansoli, Navi Mumbai, America's India Foundation, Marol, Mumbai, Lord's Education Health Society, WISH, and Piramal Swasthya Management and Research Institute.
Mr. Mishra, sir, could you please announce the winner?
This year's award in this category of excellence in social initiative goes to Maulana Azad Institute of Dental Sciences. Congratulations, Maulana.
Maulana Azad Institute of Dental Sciences.
Anybody from Maulana Azad Institute of Dental Sciences?
Vikrant, you'll have to unmute yourself, please.
Hi. Good morning, everyone. I hope I'm audible. Thank you, FICCI. Thank you, everyone, for this award. I would like to thank our Director Principal, Dr. Sangeeta Talwar, and Dr. Mahesh Verma, sir, our former director, and the whole team of the Mobile Dental Clinic, which has been working for the last 6.5 years to deliver primary and secondary level dental care to all the people around in Delhi. Not only that, we have a very integrated school program and an ASHA health worker program, and also focus on geriatric oral health care. I thank FICCI for this opportunity. I congratulate the team, and I look forward to serving and continuing our services in Delhi and around, and serving as a role model for everyone to follow in the country. Thank you so much for this opportunity.
Thank you very much, Vikrant. Sir, you remember the jury took a decision
Absolutely.
to also provide special mention to two other institutions in this category. May I request you to announce their names too, please?
The two other recognitions in this category was
Bhaktivedanta Hospital and Research Institute, a project of Sri Chaitanya Seva Trust, Thane, and Reliance Foundation, Ghansoli, Navi Mumbai.
Thank you very much. Congratulations to all the winners. Sometimes it is not possible as Mr. Mishra pointed out, to just give one award. So these two are special mentions, whilst the award goes to Maulana Azad Dental College. Now, moving on to Excellence in Home Healthcare, which is the sixth award in this session of awards. May I request Dr. Sangeeta Reddy to please be available to announce the results of this. The nominations are
Nominations in the category of Excellence in Home Healthcare are Esther MIMS Calicut and Healthcare at Home India Private Limited.
So
Dr. Reddy, please kindly announce.
I'm very happy to announce that the winner in this new and very impactful category is Healthcare at Home India Private Limited. Congratulations.
Healthcare at Home India Private Limited.
I can see Dr. Gaurav, so would you please recognize Dr. Gaurav Tukral of Healthcare at Home? Gaurav, anything to say?
Thank you, sir. I must say this is a landmark moment getting this award from Dr. Reddy, and she's saying that this is the most emerging and impactful. I also have with me my CEO, Vivek Srivastav. I would accept this very humbly on behalf of every member of my team who made this happen and impacted lakhs of life at home. So during the lockdown, when everybody said, stay safe, stay home, we brought home healthcare, or we brought healthcare at home. So that's where I think we have been able to get this done. And I think this long due recognition for home healthcare is here to stay and will change the way healthcare delivery is happening in this country to make it more accessible and affordable. Thank you so much, FICCI. Thank you so much, jury, C.K. Mishra sir. And thank you everyone for this. This is a great moment for us.
Congratulations once again. We move now to the seventh award, Excellence in Hospital Preparedness for COVID. This time we divided it into two categories. One was for the laboratory setups, that is the diagnostics, and the other was for the hospitals. So first, for the diagnostic centers or the blood banks. Let's take a look at the nominations.
COVID-19 Standalone Diagnostic Center or Blood Bank are Civil Hospital Ahmedabad and Max Lab Saket.
May I request Mr. C.K. Mishra, sir, to please announce the winner?
Hello.
Sir.
Kapil, you can start the video.
Max Lab Saket.
Congratulations, Max Lad Saket. Somehow or other, I just couldn't connect. I hope I'm audible now.
Yes, you are.
Okay.
Good morning, everybody. On behalf of Max Healthcare and the entire team of Max Lab, I would like to thank each and every member of FICCI along with jury, Mr. C.K. Mishra, Dr. Sangeeta Reddy, for appreciating our hard work in these difficult times. This award means a lot to us. I would also take the opportunity of thanking our chairman, Mr. Abhay Soy, and the management for stepping up the infrastructure, equipment, and manpower to help us meet the growing demand of COVID testing. Last but not the least, I would like to dedicate this award to each and every lab of the country, because being a pathologist, I just know how tough it has been for the labs. But this award is for each and every government, private, standalone, or a hospital-based lab of our country. Thank you so much, sir.
Kapil, do you want to continue?
Dr. Puri probably, is having some connection problems. Alok, can you take it forward?
I'm just coming in. Dr. Puri is going to join in a minute. His bandwidth has just gone off. We'll get into the next category. And the next category is Excellence in Hospital Preparedness for COVID, Standalone Diagnostic Centers or Blood Bank. Oh, this has happened already. Sorry, I'm sorry. Sorry about this. So we get into the next category, Excellence in Hospital Preparedness for COVID-19 hospital category. And the nominees are?
Nominations in the category of Excellence in Hospital Preparedness for COVID-19 Hospital are Apollo Hospitals, Chennai; Christian Medical College, Vellore; Civil Hospital, Ahmedabad; Fortis Hospitals, Mulund; and Max Hospital, Saket, New Delhi.
May I now request Mr. Mishra to please announce the winner?
One of the tough ones. Thank you, all the nominees, and congratulations for the excellent work these hospitals have done. But at the end, we had to choose the winners. The jury decided to choose joint winners, and the joint winners for this year's Excellence in Hospital Preparedness for COVID-19 Hospital Section Award goes jointly to Apollo Hospitals, Chennai, and Christian Medical College, Vellore.
Apollo Hospitals, Chennai; Christian Medical College, Vellore;
Congratulations to the winners. And may I, if somebody is there from the Apollo hospitals, okay, Dr. Puri has already joined. Over to you, Dr. Puri.
I can see somebody from Apollo. I can see Dr. Prashad.
Thank you, Dr. Puri. This was unexpected, and thank you for the honor. But all of us are here singers. Sangeeta's on the panel too. But what really makes me grateful is the fact that we've had an opportunity to serve. And on behalf of every hospital system in the country, big or small, the nursing homes who are fighting this pandemic, I think on behalf of everyone, thank you for the recognition. And I will also say that there is so much more to do. So this is just a validation of the fact that there is work to do. And for those who have lost their lives doing this, I really, my heart goes out to them and their families, that there's been a huge amount of sacrifice on lives and personal lives by all the COVID warriors in the country. So I'm grateful to everyone and to the jury for acknowledging the work done by everybody in the country. Thank you.
Thank you, Ms. Reddy. Dr. Prasad Matthews. Anybody from Christian Medical College like to make a comment? As Mr. Mishra pointed out, yes, Dr. Matthews.
So, there's a bandwidth issue. I think we can move on to the next.
Okay. Well, thank you, Dr. Matthews. Congratulations to Christian Medical College, Vellore, for sharing this honor. Mr. C.K. Mishra was absolutely right. The jury had a tough time. Not only were the nominations, the 5 that were difficult to decide, but there were 40 applicants in this category. And I think, Mr. Mishra, you agree that speaking is mentioned is absolutely true. The services offered by each and every one of those who applied has been appreciated by all the jury members. Now we move to the individual awards. Now, conventionally, this particular section, there is no other method than for the Health Services Committee members sending in nominations. So these are not to apply for these awards. These are actually selected individuals. So let's take a look at the awards that this year we are going to give. This year, for the first time, a special award category for COVID-19 was created. And let's take a look at who the nominees are for the special award COVID-19 category. So in this particular category, those who have done outstanding work as individuals will be awarded by Mr. Rajiv Gauba, our chief guest. And this year, let's look at the 2 names that have been nominated by the jury for the award. Kapil?
Special award.
This year, the award is being shared
is the consultant microbiologist and chairperson of Infection Control Committee at PD Hinduja Hospital, Mumbai. She has also worked and gained experience at CDC Atlanta, University of Texas Medical School, and St. Bartholomew's Hospital. During this pandemic, Dr. Rodriguez has played a vital role in setting up of COVID facilities in the hospital. She led the design of infection control protocols to lower the spread of virus within the hospital and ensuring the safety of healthcare staff as well as the patients. To ensure the safety of her fellow healthcare workers, for healthcare workers working in different areas of the COVID hospital and the non-COVID hospital, Dr. Rodriguez is continuing giving her war against COVID-19, and her contribution makes her a great role model for the other healthcare workers. FICCI deeply acknowledge and appreciate leadership and commitment to serve these unprecedented times, and proud to confer the special award for COVID-19. Special award
So that was
for
Dr.
COVID-19. Ms. Animol Burgess is the Chief Nursing Officer at Fortis Hospital, Mulund. She has 20 years experience, including the last 16 years serving at Fortis, Mulund. She had a vital contribution in setting up the COVID unit and COVID clinic during the start of pandemic. She also developed various in-house standard operating protocols from the beginning of pandemic for easy functioning, and handled operation of non-COVID ward and ICU with the limited manpower available to ensure the safety of the nurses and other staff. She ensured a separate hostel building to quarantine the healthcare workers. She has also trained more than
So, ladies and gentlemen, let's hear from Dr. Camilla.
Thank you, FICCI, and thank you, the jury, for bestowing this award on me. Really, friends, there's been no frame of reference in this pandemic where our health systems have been stretched with a pathogen that is overwhelmed. But never let a great crisis go to waste. And we at the Hinduja Hospital have really met every single day for the last 6 months and talked and decided and made things happen. So I'd like to dedicate this to my Hinduja Hospital Parivar for really rising to the occasion of COVID. Thank you.
You will receive this award from Mr. Rajiv Gauba, the Cabinet Secretary. Sister Verghese, share this award with Dr. Camila Rodriguez. Anything to say?
Yeah, thank you so much, Vicky, and the jury members for this prestigious award. And I would like to thank Fortis organization for nominating me for this award. As this year 2020 is the international year for the nurse and the midwife, I'm really honored to take this award in this given category. I would like to dedicate this award to all the doctors, healthcare workers, and all the nurses who work across the country and in taking care of COVID-19 patients. And of course, my team, my organization for supporting me to come up to this level. Thank you so much. And as we have seen, our country have been evolved in our healthcare practices, and I am confident this coordinated healthcare practices will continue even after COVID-19. Thank you so much. Thank you, Vicky. Thank you, Fortis, for this wonderful award. Thank you so much.
Verghese will also be by Mr. Rajiv Gauba, the Cabinet Secretary. It said if all attentiveness should be measured in minutes and all discipline in hours, then indomitability must be measured in years. And the two of you have really proved to be indomitable spirits in the fight against COVID. May your tribe grow and may your efforts continue to bear fruit for this country. So thank you very much, the two of you. It's not just the year of the nurse 2020, but September happens to be the National Medical Month for women in healthcare. So you two deserve this honor from FICCI. Congratulations once again. May we now move to the next category. Again, all these awards will be from the hands of Mr. Rajiv Gauba. The second award is something that FICCI started quite recently. In fact, this is going to be the third award in this category, and that is the Healthcare Humanitarian of the Year. This year, this award goes to a couple who's working in a village in Melghat, in the Amravati district of Maharashtra. May we have a small presentation on the work done by this outstanding couple. But before that, let's just take a look at who the previous year's winners were. can we have a slide on the previous year's winners of the Healthcare Humanitarian of the Year award? Yes, in 2018, Dr. Abhay Bang and Dr. Rani Bang, search, again working in the Gadchiroli area of Maharashtra, were the recipients of this award. Then in 2019, that is last year, it was given to the founder of CanSupport, herself a cancer survivor, Harmala Gupta, who runs the CanSupport organization. And this year, we are very proud to announce the award going to Dr. Ravinder and Smita Kole. Mr. Rajiv Gauba, would you like to say a few words?
No, I congratulate both of them, and I have heard about their, inspiring work. I'm sure their work will inspire many more doctors, to serve the humanity, especially in the difficult and inaccessible areas where access to healthcare is a problem. I had the opportunity of listening about hearing about their work earlier also, when they were honored in Rashtrapati Bhavan a few years ago. I once again congratulate both of them and wish them all success in their future endeavor.
Dr. Ravinder and Dr. Smita Kole, the recipient of this year's Healthcare Humanitarian of the Year award at the hands of Mr. Rajiv Gauba. Can we have the video? Can we have them speak to us?
The Healthcare Humanitarian Award, Dr. Ravinder Kole, Smita Kole. Dr. Ravinder Kole and his wife, Dr. Smita Kole, are working for tribal people in remote village areas in Maharashtra, India for over 3 decades. Dr. Ravindra settled in the remote Bairagad village in 1985 after completing his MBBS from Nagpur Medical College. Inspired by Mahatma Gandhi and Vinoba Bhave, he had decided to use his skills not for earning money, but to help the most marginalized segment of the society. Dr. Smita Kole, also a doctor specializing in Ayurveda and homeopathy, joined him in his mission after their marriage. Dr. Ravinder and Dr. Smita Kole have revolutionized healthcare for the poorest people in India and have overseen a program that has substantially reduced infant mortality rates in one of the most poverty-stricken areas in the world. For their revolutionary work and selfless contribution towards community healthcare and research, FICCI is proud to present the Healthcare Humanitarian Award to Dr. Ravinder Kole and Dr. Smita Kole.
Ladies and gentlemen, these are people who not only work in, but they are truly the best of the rest of us. Thank you, Mr. Rajiv Gauba, for honoring them. May I now request you to name the healthcare personality of the year that has been chosen now. But before you do that, could we have a look at the previous winners of the Healthcare Personality of the Year award? There's always a lag time before the slide comes. This award started in the year 2011, and it is Dr. Sangeeta Reddy, our President FICCI, is a part of winners. Last year, it was given to Ranjan Pai. Mr. Rajiv Gauba, may I request you to please announce the names of the winners, sir? Or would you like me to announce and then you would like to comment on it? There's some connectivity issue. Let's take a look at the two names that the jury has selected for this year's Healthcare Personality of the Year. Can we have the slide of the winners of the Healthcare Personality of the Year award?
Healthcare Personality of the Year. Dr. Preetha Reddy is the Vice Chairperson of the Apollo Hospitals Group, the leading private sector healthcare services provider in India. In addition to her responsibilities at the Apollo Group, Dr. Reddy works with industry bodies and the Government of India to advance policy decisions on healthcare issues. She is widely known for her contributions in making high-quality healthcare accessible to millions across the country. She works closely with the organization's 9,000 clinicians in introducing contemporary protocols to continuously enhance clinical outcomes. She was a founding member of the National Quality Council, an organization that created the guidelines of quality standards for Indian hospitals. Committed to service, Dr. Reddy has helmed several social projects like Sachi, that is, Save a Child's Heart initiative, that supports diagnostics and treatment of underprivileged children ailing with congenital heart diseases. FICCI deeply appreciates the immense contribution and proven leadership of Dr. Preetha Reddy and takes immense pleasure in conferring the Healthcare Personality of the Year Award 2020 on her. Healthcare Personality of the Year. Dr. Om Prakash Manchanda is the Managing Director of Dr. Lal Path Labs Limited, one of India's leading diagnostics chain. Dr. Om Prakash Manchanda is the Managing Director of Dr. Lal Path Labs Limited, one of India's leading diagnostics chains. He began his journey at Dr. Lal Path Labs Limited in 2005 from Ranbaxy. He is also on the board of leading clinical labs and diagnostic centers such as APL Institute of Clinical Laboratory and Research Private Limited and Paliwal Diagnostics Private Limited. He was the recipient of Ernst & Young Entrepreneur of the Year Award in 2019 for his entrepreneurial energy and spearheading the company's foray worldwide. Under the visionary leadership of Dr. Manchanda, the company had launched a bestseller initial public offering (IPO) in December 2015 that put the entire diagnostics sector under the spotlight in the country. FICCI deeply appreciates the immense contribution and proven leadership of Dr. Om Prakash Manchanda and takes immense pleasure in conferring the Healthcare Personality of the Year Award 2020 to him.
Thank you very much. I must apologize first of all. Dr. Kole is present with us today. So not just the video, but we are going to request him to say a few words after we have heard from Ms. Preetha Reddy and from Dr. Om Manchanda. So let's first hear from the acceptance speech by Preetha Reddy, please.
Namaste. On behalf of the entire healthcare fraternity, while the Apollo family is about 80,000 people, but it's the whole fraternity. Each one of you on the screen are friends. We've all grown together in the industry. So on behalf of all of you, I would thank the jury for the honor, CK Misra ji, Mr. Rajesh ji, all of you, for giving healthcare the kind of positioning it needs, because we are all in this crisis together. We are all fighting the pandemic together. And by acknowledging the work done by the healthcare fraternity, I think it's been a true tribute to every warrior out there in the fields. I would really like to say that it's a long road ahead, and we're all in this together. And by acknowledging the work done by every one of the awardees, I think you've just brought together a tribe which will work relentlessly and tirelessly to see that India is disease free, and that we will teach the rest of the world that we are fantastic in a crisis, because we know that our outcomes have been phenomenal, and India is poised to really heal the rest of the world. So thank you for the acknowledgement, and thank you for giving us the impetus to do more. I also would like to say that, if I am here today or the rest of the industry is here today, it's thanks to my dad, Dr. Reddy, who continues to fight this war for the entire nation. And my four sisters, it was wonderful seeing that, Sangeeta has already received the award and she's on the screen. I just wanted to say that, four of us unite and fight as one when we have to, just to see that it's a disease-free world. So thank you all for the honor conferred on me and on the rest of the healthcare fraternity. Thank you.
The Lifetime Achievement Award, the second that FICCI Healthcare Awards gave. Your sister received it a few years ago, as we showed, and we are honored to have you as the Healthcare Personality of the Year. You're sharing it with Dr. Om Manchanda, whose motto it seems is, I'll spread my wings and learn to fly. I'll do what it takes till I touch the sky. Dr. Om Manchanda, please.
Thank you, sir. It's a great honor to be selected as Healthcare Personality of the Year by FICCI. Over a long career of almost 30 years like mine, one usually gets a lot of opportunities to be recognized, but I must say this award is truly special for me. I take a moment to thank FICCI Healthcare Committee, and the jury. I dedicate this award to my team at Dr. Lal Path Labs. My achievements are not mine alone. It's a teamwork that has made Dr. Lal Path Labs the largest diagnostic brand in the country. It's also vision of Dr. Arvind Lal that we are here today. Today, Dr. Lal Path Labs has more than 200 labs, more than 3,000 collection centers, and more than 6,000 pickup points. And we nearly serve 20 million patients every year. In my view, for our country, it's time to think big and act big. I am a firm believer that a lot of issues that our country faces can actually be dealt with if we really think scale through partnerships. I and our organization are deeply committed to make quality diagnostics accessible and affordable across our country. Once again, thank you, FICCI and the jury. I'm deeply honored with this recognition. Thank you.
So you will receive, both of you will receive this award from FICCI Healthcare, Mr. Rajiv Gauba. Thank you, sir. Thank you very much. May I now request Dr. Kole, whom I'm told is today with us, in addition to the video that we saw of him. So could I request Dr. Kole to speak a few words, the recipient of the Healthcare Humanitarian of the Year Award? Dr. Kole, please.
I am thankful FICCI and at the same in and nominees of the award dedicate to thank you.
So may I request you to please switch on your video for a moment so that we can take a picture of yours.
Okay.
We're not getting it. Anyway, we'll keep trying. There's an old saying, heights reached and kept were not attained in a single flight, but they, while their comrades slept, were toiling upwards in the night. Such are people who make the organization that they serve, the individuals who make a particular industry, a particular speciality, or a particular profession shine. Today's Lifetime Achievement Award winner is one such person who has toiled over the years, first as professor of cardiology and then as the founder of Public Health Foundation of India. Yes, he's our old friend, Professor Srinath Reddy. Today, he will be receiving the Lifetime Achievement Award from Mr. Rajiv Gauba. I'm sure before this award is given to him and he has a few words to say, and we see his achievements in the form of the presentation. I'm sure Dr. Reddy would like to hear from Mr. Rajiv Gauba himself, from whom he's going to receive this award. Mr. Gauba, would you like to say a few words about Dr. Reddy?
Well, congratulations, Dr. Reddy. Heartiest congratulations. It's a well-deserved recognition of a lifetime's work. And I have had the privilege of and pleasure of interacting with him on several occasions in the past. And the kind of work which he has done, institution building, that is a rare accomplishment, and bringing public health into focus and pioneering work. I also would like to congratulate Dr. Preetha Reddy and Dr. Manchanda. They have made their institutions household names in the country and absolutely pioneering and path-breaking work in bringing quality healthcare and quality medical diagnostics accessible to millions of people in different parts of the country. Thank you.
Thank you, sir. Could we have a look at the performances that have resulted in the jury recommending Professor Srinath Reddy as the recipient of the Lifetime Achievement Award? These are the Lifetime Achievement Awards over the years. The first was in 2010.
Is presently President, Public Health Foundation of India, PHFI. PHFI is engaged in capacity building in public health in India through education, training, research, policy development, health communication, and advocacy. He formerly headed the Department of Cardiology at All India Institute of Medical Sciences. Professor Reddy is the first Indian to be elected as Foreign Associate Member of the National Academy of Medicine, formerly Institute of Medicine of the National Academy of Sciences, USA. He served as the first Bernard Loan Visiting Professor of Cardiovascular Health at the Harvard School of Public Health 2009-13. He is presently an adjunct professor at Harvard, an emerite and honorary professor of medicine at the University of Sydney. He has served on many WHO expert panels and has been the president of the World Heart Federation from 2013 to 2014. He chaired the core advisory group on health and human rights for the National Human Rights Commission of India for several years. Dr. Reddy received India's one of the highest civilian honor, the Padma Bhushan, in 2005. FICCI deeply appreciates the contribution, proven leadership, and great spirit of compassion and humanity, which has made Dr. Reddy a role model and is proud to confer the Lifetime Achievement Award to him.
Thank you. May I request Professor Reddy to speak to all of us? Srinath, over to you.
Thank you, Dr. Puri, and thank you, Sri Gaubaji. I'm most grateful to FICCI for this honor, and I receive it with great humility and a commitment to spend the rest of my life in trying to live up to this honor, to prove worthy of it. I think FICCI Awards are a very important forum for bringing to light the critical linkage between health and economic development, particularly in this era of sustainable development. It is very clear that health is both the primer and the product of economic development, and that bidirectional relationship is something that we must recognize and protect. It is also very clear that COVID-19 has clearly demonstrated that all countries, India included, need to build a worthy health system which functions well and is resourced well in the steady state if it has to quickly generate a surge response to meet the challenge of a public health emergency. Therefore, investment in health is going to be very critical even as we move along while building upon the successes we have achieved in countering the COVID-19 epidemic. We also recognize, as Mr. C.K. Mishra has pointed out, that this needs to be an all-of-society effort. It cannot be a siloed effort of the health system. And within the health system too, we do need partnerships, as have been emphasized. I would like to say that the public, the private, and the voluntary sectors need to come together and function as one harmonious whole if we have to promote health, protect health, preserve health, and restore health. And for that, I would even like to say that what the conventional word used, PPP, public-private partnership, is probably a misnomer. What we need to define PPP as partnership for a public purpose. And the public purpose is preserving and promoting the health of the people of this country. And I think bringing together all of these stakeholders into a single platform has been one of the strengths of FICCI, and these awards given today also reflect not only the diversity, but the harmony of that unity. But we should continue that as we build up our health system, and the Public Health Foundation of India and its 5 Indian Institutes of Public Health are making an effort in that direction, not only in providing support to the government and the rest of society in countering COVID, but also in trying to build the capacity for a well-resourced health system, which I believe must demonstrate relevance, excellence, and scale in order to deliver good health to all the people in this country. So I thank you, FICCI, again, and with a strong commitment that Public Health Foundation of India as an organization and I as an individual are fully committed to that common goal and vision. Thank you very much.
Thank you, Professor Reddy. Thank you for accepting this award. Ladies and gentlemen, the time has now come to hear our chief guest, Mr. Rajiv Gauba. May I request you, sir, to give your words of wisdom to this August gathering.
Thank you, Dr. Puri. Good afternoon to you all, distinguished participants in today's event. First of all, I congratulate all the award winners today, and most of all the special COVID-19 awardees. I also congratulate all the other nominees. As C.K. Mishra and Dr. Reddy mentioned, it has been a tough choice. All of them have done outstanding work. And these awards today are a recognition not only of the outstanding work done by these individuals and these institutions, but in fact by the entire fraternity of doctors, nurses, and other healthcare professionals, and also people in the healthcare industry of our country. We know that FICCI gives awards for excellence in different areas of activity every year, not just industry and commerce, but higher education, in water sector, sports, and so on. But I think this year, we will agree, all of us, that the significance of healthcare sector is by far more important than any other sector. And FICCI has been recognizing excellence in healthcare since 2009 and awarding organizations and individuals for their contributions in this field. But the awards this year carry far greater significance than perhaps in any other previous year because of the extraordinary challenge of COVID-19 which we have been confronted with this year. The enormity of this challenge, its scale, its magnitude, and the devastation that it has, and the misery that it has caused is perhaps more than that of any other similar challenge at any other time in our memory, in living memory. And we can be proud of the fact that our healthcare professionals, doctors, nurses, paramedical staff, hospitals, and Indian industry, they have all risen admirably to this challenge. I remember my first meeting in this room of the Committee of Secretaries on January 27 this year, when COVID situation had just started unfolding, and we had only one laboratory for COVID-19 testing at that time at NIV Pune. And we were discussing how to reach samples to Pune from different parts of the country in the shortest possible time. Today we have 1,087 laboratories in the government sector and 749 private testing laboratories, a total of 1,836. And more labs keep on getting added every day. And from a few hundred tests per day and then a few thousand, today we are doing 10, 11, 12 lakh tests on some days. We have even crossed 14 lakhs in a day, about a week ago, much above the WHO norm. And we have done more than 7.3 crore tests by now in all. At that time when we started this whole exercise, we were critically dependent on imports for testing kits. And today we have indigenous rapid antigen kits, more than 15 major indigenous manufacturers of RT-PCR kits. And for the last 2 months, more than 2 months now, we have been allowing exports of RT-PCR kits. It has been a stupendous effort on the part of ICMR, Ministry of Health, doctors, the private sector, the private laboratories, and the healthcare industry, the entrepreneurs. We hardly had any local manufacturing when this whole challenge started, of ventilators, for example. Today, we are comfortably placed vis-a-vis our requirement. We have supplied more than 34,000 ventilators to the states. The Ministry of Health has done so. And there is no shortage anywhere in the country, and our companies have begun exporting ventilators also. The same has been the story insofar as PPE kits are concerned, N95 masks are concerned. Today we have 135 production facilities available in the country for PPEs. In short, we have emerged as a country from a situation of near total dependence on imports to being exporters of each of these items. The healthcare industry of the country, the startups, the medical scientists, they all deserve to be applauded for their dedication and for their tremendous efforts. But we are still in the middle of this challenge. The numbers look very large, though on a per million basis, we are better off than most other major countries. In fact, the number of deaths is almost per million, 1/10 of US, UK, Brazil, etc. And we are also amongst the best in terms of the case fatality ratio. Now, this has been possible only due to the collective efforts of our doctors, nurses, and the entire healthcare fraternity. We heard some of the outstanding work done by the awardees today. We don't know when this challenge will end, but the larger challenge of making healthcare affordable and accessible, that will continue to be with us even after this COVID-19 situation has passed. I'm sure that the work done by the awardees today, their stories, they will inspire others so that we can improve our health infrastructure by coming out with innovative solutions, new approaches, so that healthcare delivery can improve, especially at the last mile. We have to improve our healthcare indicators and make them comparable to the developed countries. They should certainly be better than those of some of our neighboring countries which are at the same level of economic development. In fact, even within the country, there are huge interstate variations. Even if all the states can come up to the level of the best in the country, we would have come a long way. In this context, I would like to take this opportunity to call upon the private sector to join the PM Jan Arogya Yojana movement. 2 years after its launch, it has become a hugely successful platform for delivering tertiary care to some of the most vulnerable sections of our population. The private sector hospitals, particularly the big groups, they should come forward and join this platform. You will be doing a great service. Lastly, I would urge FICCI and the healthcare industry to help create mass awareness of the need for COVID appropriate behavior as economy and social activities open up, and now with the advent of festival season and winter, it's extremely important that people don't let their guard down. And at this juncture of our fight against COVID-19, there has to be a mass movement to make people aware that we must continue to use face masks, practice hand washing, social distancing. These are our most effective weapons, but we will need the support of each one of you in making this a mass movement. I compliment FICCI for this work of recognizing excellence in healthcare, and thank you for this opportunity to meet, though virtually, with all the fantastic personalities, individuals who have done such a marvelous job in the most important sector of saving human lives and protecting health. Thank you very much.
Your inspiring words and the messaging. Yes, very true. The mask movement must now become a mass movement. And we have been pursuing this for a very long time, and we shall continue to in the future as well. For being us, we are extremely obliged and grateful for your presence with us and to inspire many of the awardees who have received recognition through your hands. May I now request the Secretary General of FICCI, Mr. Dilip Shenoy, to give the vote of thanks.
Thank you, Dr. Puri. Mr. Rajiv Gauba, Cabinet Secretary, Government of India. Mr. C.K. Mishra, former Secretary, Ministry of Environment, Forest and Climate Change, and the Chairman of the jury. Dr. Sangeeta Reddy, President FICCI. The jury co-chair, Dr. Alok Roy, and also chair of the FICCI Health Services Committee. Distinguished jury members, award winners, nominees of the awards, and members of the FICCI Health Services Committee, participants, and delegates. It's really a pleasure to actually deliver this vote of thanks on this occasion on behalf of FICCI, of so many people who have excelled in these difficult times. This year, as Mr. Rajiv Gauba said, these awards are indeed very, very special and very relevant as we are going through these difficult times, and the importance of healthcare and healthcare workers is of supreme importance. On behalf of FICCI, I would like to take this opportunity to thank their healthcare workers for their bravery, dedication, and commitment to serve the nation in unprecedented times. And I hope over the years we have managed to create a credible platform that not only recognizes but provides a fillip for further innovation and excellence in healthcare. Let me begin by thanking our chief guest, Mr. Rajiv Gauba, Cabinet Secretary, Government of India, for accepting our invite to grace this occasion. It is appropriate at these point of times, and you heard from Mr. Gauba that they actually started the initiative as early as January 27th, and one day after Republic Day. I think his leadership and his quiet, very unassuming way of actually dealing with the complexities of this situation, as reflected in his deep knowledge, not only of the number of testings, labs, the PPEs, his whole involvement in this sector is actually truly commendable, and his leadership at this time must be recognized and applauded. Thank you very much for your useful insights, sir, and also thank you for saying that we need to continue this fight and take forward the need to take precautions and to contain this pandemic. Your words have been very inspiring to us. I would also like to thank and take this opportunity to express our gratitude to the jury panel led by Mr. C.K. Mishra and co-chaired by Dr. Alok Roy. Mr. C.K. Mishra, for many of you, even when he was the Secretary Environment, he actually headed a very important core group within the government during the times of the pandemic, focusing on the healthcare sector, and closely worked with the cabinet secretary in ensuring that we were prepared to meet the needs of the pandemic. Thank you, Mr. Mishra, for your contribution and for so ably chairing the jury. I would like to also thank all the members of the jury, not only the final jury, but also the interim jury, who took time to evaluate the nominations and recognize the great personalities whom we awarded today. I would like to thank our process partners, Ernst & Young and Astron Healthcare, who have been supporting this initiative since inception and are very much part of our growth story. Congratulations to all the winning organization and healthcare luminaries for carrying exemplary work in delivering quality healthcare and helping in scaling up the good practices and reaching out to the masses through the innovative processes. I would also like to thank and commend Shobha and the entire team at FICCI for driving this process along with the membership. Once again, Mr. Gauba, we take your messages that you have actually left us with about increasing private sector participation in free government programs, and also taking out a huge communication campaign to contain this pandemic. So thank you to everybody and to all the guests who have joined us in this virtual platform. And thank you for being with us today to share in the joy of all the award winners. Thank you very much. Keep safe and keep well. Dr. Puri, you're on mute. It's very seldom that we can get you muted.
Thank you very much, Mr. Dilip Chinoy, for the vote of thanks that you've just delivered. Please don't go anywhere, those of you who've logged in, because there is a very important session coming up from Mr. Mohandas Pai, and he's going to be talking about impact of COVID on society and culture. Also, please remember that at 5 o'clock, we will have the Vice President of India, Mr. Venkaiah Naidu, with us. So do stay tuned in. Do stay with FICCI Healthcare for the next 3 days. This is your destination. Thank you very much.
All the best.
President, thank you.
Thank you all. Great session. Thank you. Mishra ji, special namaste.
Thank you very much.